Hemoglobin. What is hemoglobin? Hemoglobin is a protein found in red blood cells that bind to oxygen in the lungs and transports it to the body's tissues. It is made up of 4 subunits, each containing a heme group, which is responsible for binding oxygen. When hemoglobin binds to oxygen, it changes shape and becomes a brighter red color, which is why oxygenated blood appears red. Hemoglobin also plays a role in carbon dioxide transport, as it binds to CO2 in the tissues and carries it back to the lungs to be exhaled. Significance of hemoglobin. Hemoglobin is a critical component of red blood cells and plays a vital role in the transport of oxygen throughout the body. Oxygen is necessary for the proper functioning of all cells, and without enough oxygen, the body's tissues and organs can become damaged. Hemoglobin allows red blood cells to carry oxygen from the lungs to the body's tissues and helps transport carbon dioxide from the tissues to the lungs to be exhaled. Hemoglobin levels can be used as an indicator of several medical conditions. Low hemoglobin levels, or anemia, can be caused by a variety of factors such as blood loss, poor nutrition, or certain medical conditions. Symptoms of anemia include fatigue, weakness, and shortness of breath. High hemoglobin levels can also indicate medical conditions such as polycythemia vera, a type of blood cancer, or chronic lung disease. Hemoglobin is also used as a marker of overall health and nutrition. Malnutrition, chronic infections, and chronic diseases can cause hemoglobin levels to drop. In addition, during pregnancy, hemoglobin levels are often monitored to ensure that the mother is getting enough iron to support the growth of the fetus. Therefore, hemoglobin level is important not only for oxygen transport but also for the overall health of an individual. Normal range of hemoglobin. The normal range for hemoglobin in adult males is typically between 13.5 and 17.5 grams per deciliter. For adult females, the normal range is typically between 12.0 and 15.5 grams per deciliter. However, these values can vary depending on factors such as age, sex, and altitude. For example, people who live at high altitudes may have higher hemoglobin levels due to the body's increased need for oxygen in that environment. It is important to note that a specific hemoglobin level is not always indicative of a person's overall health, and other factors such as symptoms and medical history should also be taken into consideration. How to maintain hemoglobin? There are several ways to maintain healthy hemoglobin levels. Eating a balanced diet. It is important to consume foods that are high in iron, such as red meat, poultry, fish, leafy greens, and fortified cereals. Eating vitamin C-rich foods, such as citrus fruits, can also help the body absorb iron more efficiently. Taking iron supplements. If you have a deficiency or are at risk of developing one, your doctor may recommend iron supplements. Avoiding blood loss. This can be done by managing any medical conditions that cause excessive bleeding, such as heavy periods or bleeding hemorrhoids. Managing underlying medical conditions. Chronic diseases such as cancer, kidney disease, or inflammatory disorders can lead to anemia. So, it is important to manage these conditions effectively. Avoiding alcohol. Heavy alcohol consumption can interfere with the body's ability to absorb iron and can also cause damage to the liver, which can lead to anemia. Regular checkups. It is important to have regular checkups to monitor your hemoglobin levels, especially if you are at risk of developing anemia or other conditions that can affect hemoglobin levels. Getting enough rest. Adequate rest and sleep can help your body recover from blood loss and repair damaged red blood cells, which can help maintain healthy hemoglobin levels. It's important to note that some people may have medical conditions that make it difficult to maintain healthy hemoglobin levels, and these individuals may require specialized treatment. If you are concerned about your hemoglobin levels, it's best to speak with your healthcare provider. Thanks for watching, like and subscribe.